It's a day on cardiology and controversies in cardiology, best practices, an integrative approach, and comments about where the profession is going in the future. My name is Terry Chappell, and I helped organize this loose confederation of people. So I want to introduce the moderator for today, which is Jeanette Soriano. And Jeanette is a family practitioner from Calgary, Canada. She trained in the Dominican Republic, and she's had experience in anesthesia as well as OB. And she was on the ICIM board for a number of years before she came here, and has been on our board of directors here for many years. We look forward to having you lead us today. So Jeanette, come on up.
So without further notice, I'd like to introduce Dr. Terry Chappell, who is really the brain behind the day, Dr. James Carter, and Dr. Lambert Parker, and they will be speaking to us in regards to the initiative of the Saving a Million Hearts. And so my first question is, could you please expand on the Million Heart Initiative, Dr. Chappell?
Sure. The Million Hearts Initiative is a program that was put forth by the Centers for Disease Control last September. And it was joined by the American Heart Association, the AMA, numerous medical groups. And basically what they did was set forth an ambitious goal of saving 1 million hearts and strokes over the next 5 years. What they decided to do was to make sure that as many people as possible had the ABCs of prevention. And the ABCs, as they defined it, were aspirin, blood pressure control with drugs, cholesterol control with drugs, and stopping smoking. And they also added a lower salt and lower trans fats in the diet, which is admirable. But my thought was that as integrative physicians, we should be doing a lot more than that if we're going to effectively save 1 million hearts. So I think the goal is laudable. But in the first place, they didn't look at other lifestyle factors. I mean, they didn't pay attention to exercise, healthy diet, stress control, which I think are basics for that. And then they also relied on drugs for the ABCs, aspirin and cholesterol drugs and blood pressure drugs. So I think that we have different ways that we can approach those. Aspirin, using maybe something else to decrease the platelet stickiness, such as fish oils and nattokinase. Blood pressure, there's lots of things we can do to control blood pressure, and of course there's lots of problems with the statin drugs. So that's how we started.
So one of the criticism of the Million Heart Initiative is the fact that they are not really having the patient as a very active participant, in terms of that is going to be mostly managed by the practitioner, but it's not truly patient-centered. Do you have any opinion in regards to patient-centered care, Dr. Carter?
Well, it sounds like the program is based on pill pushing, and that Big Pharma is in the background. But that's always the case. I mean, Big Pharma is one of the most effective monopolies ever devised. And I recently had the opportunity to review some factual information on the origins of Big Pharma. And Big Pharma actually started in 1929. And there was a marriage between Standard Oil, which is Rockefeller,
Yes.
and a company in Germany called IG Farben. And they agreed to share discoveries, chemistry, to not to compete with each other, and to fix prices. 1929. And so along comes World War II. And the IG Farben in Germany, they behaved badly during World War II. They made the gas to kill the Jews. Now this is the parent company of Bayer. They were also a powerful industrial machine that put Hitler in power in the first place. And most people don't know it, but the Allies during World War II, they had strict instructions not to bomb IG Farben, because that would be like bombing Rockefeller.
So my question is, how much money do they stand to gain if this whole Million Heart Initiative takes place?
A wild guess, but a whole lot of money.
Like what would be the...
Yeah. I'll finish with this saga in a few moments, but the assets from IG Farben, because they had behaved so badly, and some of their executives went on trial at Nuremberg. They took those assets and they moved them to Switzerland. And they changed the name to IG Chimie. Chimie is chemistry in French. Mm-hmm. Okay. Those assets sat there until JFK was elected. And JFK, his brother, Robert Kennedy, was Attorney General. And Robert Kennedy put them up for auction. And there was only one person bidding at that auction. It was no longer Standard Oil, it was Chase Manhattan. Now, the significance of this is that every single major pharmaceutical company that you can mention is a descendant of that original cartel agreement back in 1929. And they just have a very effective monopoly. They don't believe in free enterprise, but they have a masterful way of making friends with people in high places, especially in some of the regulatory agencies like the FDA and others. And they can use their friends to help them reinforce the monopoly.
Okay, thank you. Dr. Lambert, now that we are talking about saving 1 million hearts, what would you consider would be the most appropriate primary prevention initiative that we should be taking?
Okay. I'd like to take one step backwards and kind of make a simple comment that we were all told very, very early that the way to hell is good intention, and devil is in the details. So I would put that out here because I think initiative is excellent. I think nobody will really disagree. Primary prevention. Primary prevention basically means you don't have the illness and you don't have the disease. And so secondary interest would be, same thing, it goes by illness and disease and your positive and negative. So as what they're doing in the American Heart Association, even Allscripts, which is the big electronic medical records, is putting it part of their system. So it forces even the cardiologists, anybody using the electronic health records, to make sure they ask the questions and take care of it. So it's very laudable. We have to give them the credit for it. But at the same time, as Dr. Carter said, a lot of what we're caught in a social-political system. And just because something is nice doesn't mean the end result will be nice also. In simple things, my feeling is with the primary prevention, we as integrative physicians need to get past all that. The doctors, the MDs, DOs like us who are doing mainstream medicine, we push pharmaceutical medication. But then I would also make a case, those of us who are integrative medicine or naturopathic medicine, we push pills too. It's just that the pills we push, the naturopathic industry, is $1 billion industry, whereas the pharmaceutical is $1 trillion industry. And what we push is less lethal than what they push. And we're seeing a lot of them. So I think we need to step back and see if we want to take the high road, we have to start looking at things like, for example, pomegranate. Instead of just pushing the pills and telling the patient, you got to take this because it's good for you, we need to get to the root cause and find out, and with basic sciences, why are we doing what we are doing? And primary prevention is to prevent, like when the easiest thing to explain primary prevention is when a woman is pregnant, you want to prevent epigenetic damage or damage to folic acid, so there's neural tube deficiency, by giving them things before an illness or a disease even becomes manifest. So in cardiac disease, it's cardiovascular disease really, it's a huge issue. And a lot of the common denominators, where the major cause of cardiovascular disease is coronary artery disease. That's a major killer. Then the second major killer in the Western world is all-cause mortality in all cancers. And the third one is strokes. So they all have, the triad have certain commonalities. Whether it's oxidized LDLs, when we say cholesterol drugs, we know Lipitor, Crestor just got off the market. All those things are powerful drugs. But unless we realize we're dealing with a human being who is very special, epigenetically very special, environmentally very special, culturally very special, unless we put all those things together, I don't think you can really make that 1 million hearts in 5 years. It's impossible. I think that's why the mainstream medicine, even though their idea is excellent, they're trying to do the same thing that mainstream medicine is based on. That's public health system, which means a bell curve, and you want to cover everybody within the bell curve. But those who are on both sides of the bell curve, well, they're expendable. So, and also the medical records, which is what everybody's pushing for, also makes you not take the individual patient, which is what you said, what's patient involvement, what the culture, what they eat, how they do things, do you walk, all those things are not taken into consideration. I think that's why it's not going to really succeed. They're going to make it succeed because it's playing statistical games. Richard Feynman once said, statistics like a woman in a bikini shows a lot of things, but not the crucial parts. And if you look at the statistics on cancer, you see that all the time. People play games with the statistics. So I'm sure in 5 years they're going to say what a great job they did. But I think we need to get back again. What's really happening? If it's cholesterol management, Lipitor and all those things haven't really shown to regress atherosclerotic heart disease. There are a few studies here and there. Any meta-studies, any big studies has shown it may stabilize it, maintain it, not make it progress, but actual regression, it doesn't do. But here we have things like pomegranate and other things, where there are good studies which shows there's actually regression. I think which means if we really care about this topic, we need to educate ourselves. Things like what Dr. Chappell has done, these kind of meetings, we can first know what are we talking about, what's the North Star, what's our goals, how we define the terms. Then we have the same language. Then we have a powerful movement to work with the cardiology colleagues, with the internist colleagues, and say, you know what, I agree with you, but how about this? If you're using aspirin, aspirin studies are excellent for heart disease. But what about people who can't tolerate aspirins, especially women? A lot of aspirin studies were done on men. And women, aspirin really doesn't work as well. So why doesn't it work? Maybe we can try something like anything from nattokinase or many kind of different kinase and enzymes. Or when we come to cholesterol, we see so much now with the Lipitor and all the other things, we're seeing damage to the brain, which makes sense. I mean, here you're interfering with the cholesterol cascade when the brain is mostly fat and water. Or hormones, if you're blocking the cholesterol, and cholesterol is a precursor for every hormone or almost every hormone in the body, and we're interfering with it, and then we wonder what something happens, why maybe people get cancer.
So going back to my question of primary prevention, when would you start? What age, Dr. Chappell? Would you start with primary prevention? From in uterus, from elementary school?
I think one of the biggest problems we have right now is the epidemic of obesity in children. And that leads to all sorts of complications, from diabetes to vascular problems and so forth. So I think exercise and diet, and it's kind of hard to get beyond the elementary schools, but certainly it should be a lot more aggressive in the elementary schools. And
then what would be your approach for secondary prevention? Once we know that the patient already have established hypertension or have had a non-ST, MI, or...
Well, I think that it's very important to look at a broad spectrum of risk factors. The lifestyle is the beginning, obviously. But then beyond that, we can look at homocysteine, we can look at C-reactive protein, we can look at vitamin D levels routinely. I think we're going to be talking about sugar metabolism, metals. There's a lot of risk factors that we know about, and they're all documented in the medical literature, but most cardiologists don't pay much attention to them, or if they do test for them, they don't do much to correct for them.
You have anything to add, Dr. Carter?
I don't think we fully understand why, in this country in particular, less so in Europe, there is this pervasive march towards obesity and its complications. I mean, it's not as simple as installing some exercise paths in the park. It's got to be very complicated. It's tied up with the food supply and what's in the food supply. We know a few things like high fructose corn syrup is bad stuff for you in a systemic way. And the whole effort to combat obesity in childhood and adulthood seems to be doing the same thing over and over again. And you know what Einstein said. They're expecting a different result, and they're not going to get it.
So let's say that we were all invited to be part of the Saving a Million Heart Initiative, and prior to publication, what would you have done different, Dr. Parker? So let's say that when this Million Heart Initiative was being worked at, if we would have been invited to it to be participants in drafting the
lifestyle
the program, what would you have done different? And briefly, like 1
body
minute.
in motion. You got to get the people moving, and I think it's not just the woman before even pregnancy. I think we're talking about epigenetics. We need the whole society has to get up and move. The body has always had to be in motion. Yeah. So it doesn't matter what diet, what it is, you have to move.
And
well, the next subject is lifestyles, and you can simplify that in a way by saying the most important factors in lifestyle restructuring or management are diet, exercise, and faith, not mentioned on our program, but faith is defined as that when you wake up in the morning, you got a feeling that it's better to be alive than dead.
Sounds really good to me. Dr. Chappell, what would you have done different?
Well, one thing that's neglected, I think, is stress control. We do routine heart rate variability tests in our office, and almost everybody has decreased parasympathetic activity to deal with the sympathetic activity that comes up in their daily lives, and very few people do much to control stress on a regular basis, and it makes a big difference when you can.
That's a very important point, and we can learn a lot from other cultures. You know, one way of dealing with stress is meditation. But you try and get a group of teenage kids in this country and try and teach them how to meditate, you're not going to get very far. Now, you might be able to get them into karate or tai chi, and they may go for that, and that has some stress-reducing components. But everybody's stressed out in this country. They're not sleeping well. They don't get restorative sleep. And that's a problem that's very significant in terms of primary prevention.
Any question from the audience? Or comment? Dr. Wilson?
I was going to comment on Terry's comment about doing heart rate variability. I don't think anybody goes into a doctor's office who doesn't knock out their parasympathetic nervous system, so it's probably not the best place to go to measure it.